As we told you yesterday, Maryland nursing homes are now preparing to let visitors back inside, getting the buildings ready, setting up meeting areas. Now, the state of Maryland is testing visitors for COVID and providing results in about 15 minutes. But the question we have tonight, how effective is that type of test? Jess Arnold joins us with the answer. Hey, Jess.
Hey, Bruce. Yeah, long-term care facilities are some of the highest risk communities. So the president of Sagepoint, which saw nearly 100 resident cases at the height of the pandemic, wants to make sure that they keep that virus out. I spoke with the president of the Mayo Clinic Laboratories to get some answers on the difference between that rapid on-site test and the molecular lab test, their efficacy, and some of the screening methods they can use to keep the folks inside safe.
The entire point of testing is to try and catch asymptomatic and pre-symptomatic individuals.
Right.
That's what nursing homes are trying to catch before they have a spread.
President and CEO of Sagepoint Senior Living Services, Andrea Dwyer, is concerned about using the 15-minute rapid antigen test the state gave them, since the Maryland Department of Health says they're best used with high viral shedding, probably within the first 5 days of symptom onset. What's the difference between that rapid antigen testing versus the PCR one? He said the antigen test uses a chemical reaction on site to detect the presence of a COVID protein. The PCR or molecular test uses a special machine in a lab to analyze the virus's genetic material.
The advantage of the antigen test is that it's much more convenient. It can be done right at the point of care. It doesn't require a special machine to analyze it or anything else. The advantage of the molecular testing, even if it has a special machine on site, is that it does amplify, so it tends to be more sensitive.
Dr. Morice says sensitivity and specificity are the two things they're looking for in determining a test's effectiveness. Sensitivity being how likely the test is to be positive if you have the virus, and specificity, how likely it is to come back negative if you're not infected.
What you really want is something that will be very likely to be positive in someone who has it and very unlikely to be positive in someone who doesn't. The challenge with COVID is that we know individuals are most likely to spread it before they have symptoms, meaning that you're really trying to catch the virus earlier in the course of the infection, which of course then it really stresses the sensitivity.
To circle back to Andrea Dwyer's question, is an antigen test an effective tool to prevent an outbreak?
Testing is just one element, and you really have to have other measures in place because nothing's going to be 100% in terms of just doing a test and being able to say, well, the test is negative, it's now safe for people to interact as if COVID didn't exist.
Dr. Morice says masks, social distancing, and screening visitors will all be critical. Now, when it comes to screening visitors, the doctor said researchers are working on other methods to detect the virus, like different biologic signs that dogs could sniff out. But Bruce, at the end of the day, he says compliance with these prevention measures will be key.